and record also that I'm also not new to Nyandarua. I started my career here in this same hospital. I did my first Syrian section as a medical officer in theater here back in 1994. On the issue of asymptomatic carriers and the ability of asymptomatic positive COVID-19 positive individuals transmitting the virus, I think there was a report or a statement issued from the WHO that once stated that the issue of asymptomatic positives shedding the virus is very rare. And you will recall that the following day, that statement was pulled down. It was reversed, so we urge you to continue with what we had always advised. And we have seen very many asymptomatic positives even in our community, and others turning positive in their midst. So the possibility of asymptomatic positives shedding the virus to others is still live. And so the use of the mask, what CS has stressed, and we keep stressing, and I can see some of us are not wearing the masks in our midst. And we keep saying, if you see someone not wearing a mask, mwambie kuondoke tafadhali. So if you are not wearing your mask, please protect us. So asymptomatic positives can still shed the virus. We maintain that, and we maintain our masks. The issue of mutations, yes, they have been recorded in very many, and WHO has recorded a series of this. You asked whether we have any of recorded this in the country, and yes, we are in the process of conducting a research. It's being done in one of our labs in Kilifi, and there are some preliminary results that are showing, yes, there could be some mutations, but the report will be out once it is validated from other Cambridge labs, and you get this in due course. On the issue of home-based care and the protocols being issued by WHO, we as a ministry have issued our home-based care guidelines. And there are criteria we use to allow you to be isolated at home. And if you go to our website, www.health.go.ke, those guidelines are already there. You can go through them, read them, and you see the criteria under which we are allowing people to quarantine at home. Upon discharge from quarantine, there is a requirement, or there used to be a requirement that you are tested again. Again, we are in the process of reviewing our testing strategies, and WHO also is recommending that if you are asymptomatic at day 14 of follow-up, that second test may not be necessary. But you are in the process of reviewing this with our case management experts, so that you don't want to say that you don't want to go through a second test, but this will be confirmed in due course. But for those who have no symptoms and they have a place that you can stay and be able to isolate yourself, and on condition that you have someone who can take care of you, and that person has adequate PPE to protect him or herself, then a healthcare worker will assess your home and you'll be allowed to isolate yourself at home. This is going to help us in offload our healthcare facilities, which may soon get overloaded. So we are urging all of us to start preparing, of course, for those being able to care for your loved ones at home, and familiarize yourself with those guidelines as we go along. Thank you.
Asanteni sana.
Just one, mwisho kabisa. Just the last question.